to the epidemiology lecture series. Today we are going to talk about how to evaluate the effectiveness of screening program. We can discuss several specific methods that we can apply to decide the effectiveness of a screening program. But here I will discuss the basis or the fundamentals of evaluating the effectiveness of screening program. One of the major methods that we can do is calculate the yield. Yield is if you have a 2 by 2 table, yield is A divided by A plus B plus C plus D into 100. If the yield is high, we can think that the screening program is effective because after applying the screening test, we could capture a lot of patients. This is again associated with the prevalence of disease. If you apply yellow fever screening program in Japan, it's useless. But if you apply yellow fever screening program in Africa, it's effective. If you apply dengue fever screening program in non-endemic areas, the screening program will not be effective. But if you apply screening program during an outbreak, that will be effective. Yield means how many true positives that you can apply out of the total population screened in a screening process. Another method is assume that there's screened population and non-screened population. This is screened population. In this population, we applied the screening test. In this population, we have not applied the screening test, non-screened population. At the end of the screening process, we can evaluate how many of them have died out of 1000 people. So X over 1000. And how many of them have died in this non-screening population? Simply, we can compare the mortality. Also, we can compare the morbidity. P over 1000, Q over 1000. How many of them have developed complications or bad complications in the screening population? How many of them have developed bad complications or specific complications in non-screened population? This is another method. We can call this as comparing mortality as the second method. Comparing morbidity is the third method. The fourth method is you can compare the duration of survival of screening population with the non-screened population. So here you can calculate the average survival duration. Here also the average survival duration of non-screened population. If I summarize the methods that we can apply to evaluate the effectiveness of screening program, yield that we discussed, comparing the mortality, comparing morbidity between screened population and non-screened population, comparing the survival of screened population and non-screened population, and specifically case control studies, cohort studies. We are not discussing the case control studies and cohort studies in this specific lecture because we discussed these two things in a separate video, and you can list many other methods to evaluate the effectiveness of screening program, but here I discussed the basis. We can assume that if the mortality is less, if the morbidity is less, if survival is high, if the yield is high, this screening program is an effective program. I hope that you have a basic understanding about how to evaluate effectiveness of a screening program. Now, we need to discuss, before finalizing the screening lecture, we need to discuss another topic, importantly, 3 biases affecting the evaluation process of a screening program. In the next lecture, we will discuss volunteer bias, lead time bias, and length bias in detail. Thank you for listening.